I'm Zacchaeus. I am the co-founder of Marymount Labs and the winner of Health Hacks 2024. For Health Hacks 2024, my team built a patient engagement solution that used the health belief model to understand the beliefs of patients when it comes to persuading them to take up health activities. So at Marymount Labs, we are working on the complexity of healthcare financing. So that complexity leaves a lot of providers struggling to capture revenue opportunities. And we have developed a proprietary software that maps out the complex business logic that essentially helps providers identify the fundable gaps and turn them into revenue opportunities. But it's not just about the bottom line that we are concerned about. I think by tackling this area of complexity, we are aligning the value between providers, patients, and payers. One example would be our work with Healthier SG in Singapore, where we are helping clinics identify the care gaps when it comes to preventive and chronic care. So I guess joining Health Hacks 2024 was really an opportunity to explore how we can apply large language models and techniques in AI into the healthcare industry. Now, I think the advent of this new technology offers infinite possibilities, but healthcare itself is an industry where the adoption of these technologies is challenging, mainly because of barriers like data privacy, regulatory hurdles, and so on. So I thought that Health Hacks was a great opportunity and avenue for me to bridge this divide, allow me to prototype something useful and gain feedback from the medical community. First of all, I think Health Hacks was a great opportunity for me, not just to build the product, but also to witness what the other teams were doing when it comes to the application of large language models or AI technology to building solutions for the medical community. I most appreciated the feedback, the candid feedback from the judges, many of whom were medical professionals themselves. What struck me most was that they were not dismissive of the solution, even if it was just a prototype. They offered very grounded feedback on how such a product could eventually be implemented in the healthcare setting, and also gave feedback on how to consider about the business model sustainability aspects. The structured format of the hackathon gave us this time to really think through not just the aspect of building that product, but also how we could refine that pitch to be accessible to a medical audience. Now, unlike other hackathons which forces you to come up with the idea and build it and pitch it within a 24-hour time frame, I think the health hack format, which had this space of maybe 1 to 2 months, provided us ample time to really gain feedback from the medical community that we spoke with. And I think this really resulted in a more well thought out solution at the end of the day. I guess one of the most challenging parts of this hackathon was really about narrowing down your ideas. Now, with large language models, I think there are infinite possibilities, infinite creative ideas that you could apply. But our team came to realize that the first solution isn't necessarily the best solution. I think the challenges when it comes to digital hackathons in the healthcare space is really about thinking through, the second order plans that come after developing the idea. For example, how do you integrate this into medical practice? Is it ethical? How are you going to safeguard the privacy of patient data? Winning Health Hacks allowed us to refine our pitch, ensure that it's accessible to a medical audience, and we were really encouraged by the positive reception from the community of medical professionals as well as innovation practitioners, and that really encouraged us to move forward with our ideas. I think during the hackathon itself, after we pitched, many partners were actually interested in approaching us to explore commercial angles to pilot our project. And from this hackathon, we gained a whole host of contacts in the healthcare industry, from players in the pharma industry to healthcare practitioners, as well as heads of innovation ecosystems. First of all, we recognize the network-centric nature of the healthcare industry. We know that a lot of it is going to be driven by the relationships we have in the healthcare industry. So we needed this platform that allowed us to gain access to a wide range of healthcare practitioners and heads of innovation ecosystems. Now, the second reason also is that this accelerator is unique in the sense that it is geared towards entry into the US market. And we know that healthcare expenditure in the US market far outstrips any other expenditures probably in the world. And therefore, there was this great sense of opportunity to enter the US market. And the third reason is that this accelerator program is run by medical professionals themselves who are early adopters of innovation. And this makes it distinct from other generic accelerator programs that may be focused on teaching startup basics. I think that's not what we needed at this stage. What we really needed is to understand the perspective of healthcare providers, how they think about implementing digital solutions in their line of work. And I think that the NUS Medicine Digital Accelerator really offered this range of high caliber mentors who were experts in their own fields that were able to guide us through some of the more challenging questions, answers that could not be found on the internet. So the program, I think, enhanced our credibility and market readiness. Now, I think healthcare providers generally have this reluctance to adopt digital solutions, especially if they are by newer companies. But I think that this accelerator gave us this confidence to approach healthcare providers, and the network that they had were those who were already keen on adopting digital solutions. So that really closed the gap when it came to early stage commercialization. I think a great example is also one of our mentors invited us to this closed-door GP conference where we were able to share our solutions with GP doctors, gain their feedback, and understand better how to position our products. We're looking to double down on this thesis that we need to elucidate the fundable care gaps in healthcare. So that includes primary care, specialist care, as well as other healthcare verticals. We're also interested in expanding into the US. We have spoke with our mentors and think that accountable care organizations and private insurance may be key customers. So healthcare is really an industry that provides you the opportunity to transform complexity into clarity. Now, I would encourage teams not to stick with the first solution that comes to their mind, because it may not be the best solution. There is, however, ample time during the duration of the hackathon for you to realize the solution to its fullest potential.